Yes, okay, we're recording. I almost forgot. So we're recording. So thank you for coming. This is a presentation about body dysmorphia, self-esteem, and self-acceptance after spinal cord injury. As usual, these programs are made possible thanks to the generosity of our donors. Without them, we could not do the things that we are doing for the SCI communities. We're very, very grateful to them. Everyone should be muted, so that way we can eliminate any unwanted background distractions, and so that you don't hear anyone other than our panelists, Lihia, myself, and Dr. Pasapenodia also talking. We welcome questions from the audience, and we will collect them all throughout the event. So please put any questions you have into the chat box for us, and we'll go through them together after we're done getting stories from the panelists and their experience and when they're done talking. We are recording, as you know, so if any of you need to jump off of the meeting or if you want to revisit this information, you can always come back at a later time. It should be posted on NorCal's website eventually, or on their YouTube page. And I think that is it. So I'll introduce myself really quick. I am a dietitian. My name is Shelley Wood. I have been a dietitian for 10 years this year, and I want to say at least 90% of the time it has been in working with the spinal cord injury community. I would not be talking to you all right now if it were not for Franklin, one of the founding members of, one of the founders of NorCal SCI, who we lost last year. So I am proud to be here, and I'm proud to do a lot of work with this community. I've done research, inpatient work, outpatient work. I am involved in a lot. So, and I'm super happy and proud about it. So that is me. Lihia, do you want to introduce yourself?
Yes, hello everybody. My name is Lihia Andrade Zuniga, pronouns she, her, hers, ella. And I am a peer supporter through the Santa Clara Valley Medical Center. And I also do a lot of different work in disability justice around the state and in the county that I live in. I live in San Mateo on Ramey-Tish Ohlone land, and I'm also on a school board. So a lot of my work is in policy and legislation around people with disabilities. So just all of this is really important. Thank you so much for being here, everyone, and happy Women's History Month to all you ladies out there, and also happy International Women's Day. That's today. So thank you. So we're going to start by sharing some information with all of you before we get into our panel. And then we will have some question and answers. And so get those ready. We can discuss those after the panel is finished with their questions, just to make sure that we have ample time. Okay, so let me share my screen. Forgive me, it takes me a second.
Lihia and I, we met like in November, I think it was. And it was more on a clinical thing. I was her dietitian. We had a very passionate talk about body dysmorphia and body image. That's how this came to be. And I come across this all the time in my work with my patients, and body self-esteem and body image, and after spinal cord injury, and it's a big deal out there. And Lihia, what do you want to add to how this came to be?
Yeah, just that we had this conversation, and excuse me, in the community, we hear a lot about, mental health and how it's affected after any sort of, significant life change. And that's what this is. We've had our experiences as folks with lived experience. I have a spinal cord injury myself. I have a C5-6 Asia A spinal cord injury from a car accident. And I know that for me, my self-perception and acceptance and all of that, it changed after my injury. And so I know that's not unique to just me, and so we thought about having this conversation because although we do hear this in the community, there wasn't anything like structured that people could get information from and hear from peers, but also to think of solutions and some assistance in that way, because, you know, I don't know if I'm sure I speak for many of us that believe that the beauty of this is that we are part of a extended family, pretty much, of folks that we're all in this together and we need to help each other. So that is why this all started.
And I want to add, there is not a lot of information in the literature. We also have with us, listening in also has good extensive experience with spinal cord injury and rehabilitation disability, but Dr. Pasapanodia is with us. She and I worked together. I love her. She's amazing. But she was able to pull together some resources and some books that we can share with you later. But I did some literature review. I'm looking for research studies regarding this particular topic, body acceptance, self-esteem, body dysmorphia after spinal cord injury. There really isn't a lot. She did some research as well, and there isn't a lot of research out there regarding this. Most of the research that's out there has to do with BMI, body size, chronic comorbidities, diabetes, heart disease, that kind of thing related to body size, but not self-acceptance, not self-esteem, and you know, that specific thing. So it tells us that there is a big need for research out there in the world in terms of body dysmorphia. So that's what we have as far as what's available out there.
And so these are some, some suggestions on where you can find some support. We'll get into a little bit more with our panel on where they, they found their support, but these are just some like little samples. It's, not by any means the only thing. So, and if anyone's interested in these slides later, please put your information in the chat and we can go from there.
We can probably have NorCal share as well.
Yeah.
I'm thinking in a newsletter or follow-up email. Okay. Okay.
And these are some, oh, sorry, go ahead, Shelley.
I just wanted to mention, I don't know if I mentioned this earlier, but this is planned for an hour. If we run over a little bit, that's what'll happen. But again, we are definitely going to be, we're recording right now, so you can come back if you have to go. So yeah, go ahead, Lahidia. We have some books that were brought to our attention from our psychologist who's also listening in.
Yes, and these are some more resources that you can access. And then this is all our contact information, so later we can share all of this. And Christian will share her info in the chat after she speaks or after towards the end or whenever she would like. But this is some of the information that we have.
So we have 4 panelists that have agreed to share. We have some specific questions that Lihia came up with that we thought would be of use to everybody. And so we're going to kind of go through these questions one at a time with our panelists. And we thank them from the bottom of our heart for sharing their experiences and their thoughts on this subject. Okay. So I will keep an eye on the time.
Great. Okay, so why don't we jump right into the questions? First, I'd like the panelists to introduce themselves and, I guess, basics, right? Name and all that, but also, I guess, why this was important to you to be part of this panel. So why don't we start with Christian?
Hello, my name is Christian Roundtree. I've been disabled for 13 years. I just had my chairversity, I call it my chair anniversary, February 13th. I am a school teacher. I was a softball player, had a full ride scholarship, softball player while I got injured, headed to a softball game in process of me being a teacher. So my injury didn't stop me from going out for the career that I wanted. I am now a third year teacher. I'm teaching fourth grade. I recently bought a home, so that didn't also stop my dreams. I'm loving life, and I'm actually lived the best 13 years out of my whole 34. So my spinal cord injury has enhanced my life in many ways. The only thing I can't do is run the bases, but I definitely can coach someone else how to do it. Yeah, that's me in a nutshell. Still loving life and living it to the fullest.
Thank you. Let's continue with Chelsea.
Hi, everyone. My name is Chelsea, and I'm a C4 quadriplegic. I was in a car accident 3.5 years ago. I am now 26 years old. I am currently a peer mentor through the Triumph Foundation, which has been such an amazing experience and resource for me. And I'm also now an intern for Backbones organization. It's a nonprofit organization, and they help individuals with spinal cord injuries. And I'm just really grateful to just be a part of different nonprofits, and just to be all the support that I'm getting, and then also giving that support back too. Yeah, and I'm actually currently going back to school as well. In May of 2019, I graduated with my bachelor's in psychology. And so now I'm kind of going back to school and figuring that out with possibly pursuing a master's degree in counseling. But yeah, I'm very grateful to be here and to share my experience with all of you, and also to learn and grow. So thank you for having me today.
Thank you. And now if Hector del Valle, if you can also introduce yourself, please.
Hello, my name is Hector del Valle. I am a social worker and a speaker, and I just got my certification in consciousness transformational coaching. And I specialize both in addictions and disabilities topics. I've had the honor of working with Rafi and Leah on 40 episodes on sexuality that we did, and that was a lot of fun. So I'm just excited to be here, to be on this. I'm a C5, C7 quadriplegic from an auto accident when I was drinking and driving when I was 17 years old. Today, I am now 58 years old, 40 years plus in the chair, and I can't agree more with Christian that this has really done wonders for my life. And I know it sounds strange because it has done wonders. You from day one, you are constantly trying to figure out, how am I going to figure this out? And how do I find a way to do this, because I want to do this? So I'm just excited that I've been invited to be part of a panel member, and just excited to be here to talk about our image. I just completed a course that we're soon going to be putting out there that falls right in line with this, Shelley. So I'd like to talk to you more about this in regards to helping men with spinal cord injuries find their value and their worth. And body image has a lot to do with it.
Would love to talk to you. Thank you for sharing.
That's great. Thank you, Hector. How about Rafe? Go ahead and introduce yourself. Thank you.
Hello, everyone. My name is Rafe Eric Biggs, and I am a 53-year-old man living in Berkeley, California. I have a C5-6 spinal cord injury. I was injured in 2004 from a fall from a one-story building in India. And, the injury's been, I'm also working as a peer mentor for the Christopher Reeves Foundation currently. I'll add that too. And I also work, started an organization called Sexability, and we've been working with Likia for many years around coaching people around intimacy, sexuality, and spinal cord injury. So this topic is something that I believe is really important for me personally and professionally, as it's a big transformation, as Hector said, going through the life of injury. And it's been almost 19 years I've been injured. It'll be 19 years in April. So I really feel honored and privileged to be here, and happy to share my story and information with you all.
Thank you. Yeah, Rafe brings up a good point that I should have mentioned. Sexuality and disability, goes into all of this as well. So if you need information on that, like Hector said, Rafe and Hector and I just finished a 40 episode sexuality and spinal cord injury and MS and ALS series on YouTube. So if you're interested, it's through Sustain Our Abilities, and it's called Everlasting Love. I was going to say Endless Love, but that's not true. Everlasting Love. Okay, well, thank you. Yeah, thank you for our panel. So why don't we go ahead and start with some questions? We can start with Rafe, since you're here and you just have been spotlighted. So how have your eating habits and diet changed since you've had an injury? Where did you find the information that you have on your diet and nutritional issues, and or a plan or whatever you do in your life around your nutrition?
Sorry, I thought I had myself unmuted. So regarding diet and nutrition, I've had a pretty healthy diet most of my life before my injury and even post-injury. Just kind of grew up learning some healthy eating habits mostly from my family. I had a mother that was very nutritionally focused and learned to eat some very delicious and nutritional foods. Didn't really have any limitations on my diet before my injury. After my injury, really been focused a lot on protein and fiber. And I've learned from a lot of different people, other people that are quadriplegics, as well as work with nutritionalists, including Shelley and other nutritionalists and dietitians. And then I've also had some GI doctors. And as my injury has continued, I have had to make some modifications and changes just to kind of accommodate my aging of my body. So that's been something I'm currently going through.
Thank you. Anybody that wants to jump in next?
Yeah, I just same question.
Yes.
Yeah, same question. So it's there are no coincidences. Matter of fact, I just met with my gastrologist on Wednesday. All right, because diet is an issue for me. 40 years post. Presently, I'm experiencing some bloatingness and so forth. And the big reason for that, I know, is my eating habits, and my lifestyle. I pretty much have always eaten what I wanted to eat, even with the injury and so forth. And now aging with a spinal cord injury is catching up to me. All right, the organs, the stomach is just not cooperating. I get a lot of stuff with acid reflux. It just the bloating and the bowel and bladder care has now become an issue because of my eating habits. So I am changing that, and I have changed that. One of the things I have done is I switched from pretty much just eating whatever I wanted in the morning, starting out with just fruits for breakfast. I'm also a big believer, like Rafe, that protein is a big part of it. Whenever I have issues with my skin, I uptake on the protein because that's a fast healer for me. And of course, staying off, my skin or that area has always worked for me. But in regards to diet, yeah, and I still got a lot of practice with this, guys. So fruit in the morning works for me. And then I try to, the professionals tell me that I should break it down to at least 5 little short meals a day, 5 to 6 little short meals a day. I still haven't practiced that very well. I've used food as an emotional filler at times, what we call emotional eating sometimes. So when I get anxious, when I get nervous, I go right for the sweets, so that's something that I'm working on presently right now. That's why I was very interested in this topic, especially when we started out with the whole nutrition aspect of it, because that's only one piece of how, we look at ourselves and what we are, what we eat, as some would say. So I am definitely working on that. So the way I'm just changing it is just trying to not so much call it a diet, but call it a lifestyle, and just knowing that I can eat better during the day, that I can make better choices, than thinking that, because sometimes I would just eat because I knew I had to eat, but I would stick to the finger food because that was to be something that I can hold at and be independent in my eating, or I would eat fast, because I didn't, it was so slow in eating and holding the utensils and stuff like that. So I would constantly try to just fill up with food just to say, okay, I'm done, check it off. I've eaten my breakfast, check. I've eaten my stuff. So that's where I'm at with regards to that. Thanks.
Yeah, thank you. No, those are really good points. I mean, we don't realize, what our habits are that may not be as, as positive for our diets or for our process of our elimination and all that and the digestion. How about Chelsea?
Yeah, so before my injury, I pretty much kind of ate whatever I want. I at times, of course, I tried to eat a little bit healthier and stuff, but I'm also an emotional eater, and so whenever I'm, sad or anxious or something, I always crave, of course, like chips and all the food that you're really not supposed to eat. And so after my injury, I've been really just trying to focus on shifting that and filling that with like healthier snacks. So if I'm like getting hungry or anxious or something, I try to go more towards like veggies and stuff like that instead of the chips, and it's helped a lot. I also struggle a lot with bloating, and it's totally all about diet for sure. Like I've noticed when I have like more additive sugars or even just like breads and stuff like that, I tend to kind of like my stomach will hurt or I bloat more. And so I try to really stay away from that and focus more on like lean meats and like more veggies, a lot more water. And pretty much all I drink is water. And then I'll have a cup of coffee in the morning, and that really helps a lot, just focusing on my water intake as well.
Yeah, no, and thank you for sharing some of those solutions that you've had, incorporated. That is helpful. Christian.
Prior to my injury, I was an athlete. So I had that outlet to work out. So I could literally eat whatever I wanted, knowing that I had practice the next day and I was going to burn whatever I ate out. And being a college student, of course, those college parties where you have beer and alcohol is unlimited, it's that I could do whatever, however I wanted and not gain a pound. Like I went from 135 that was like my heaviest able-bodied. And I got back to that point. I got lower than that when I was in rehab. And they're like, well, you're too skinny. And I'm like, well, I look good. And they're like, it's not healthy. So they bumped me up a few pounds to get me where I needed to go. And then maybe 3 or 4 years after my rehab, I gained about 50 pounds. So I had the chair that had the armrests that were attached to the seat. So I was bulging out and I could barely fit in my chair. So it was really hard for me to see like what was the issue. So I cut back, I started portion sizing. I didn't go to a dietitian because I was like, I'm an athlete. I went through nutrition. I could do this myself. So I did start portion sizing and started to have those 5 to 6 small sandwiches and cups of peanuts, or I went on to myplate.org and I just went crazy and just started portioning myself. And that helped tremendously. I lost the 50 pounds and I got back to a weight that I liked. I haven't gotten back to that 200 pounds, which is amazing. And I'm kind of fluctuating, knowing I shouldn't eat my chips or get a bag of gummy bears, but sometimes you just have those cravings. So being so active with school and teaching, it's hard for me to be like, okay, well, I'm going to cook dinner, but DoorDash is on my app on my phone, so it's a lot easier to go eat out. So it's an up and down process. I don't have that. I can't burn the fat like I used to, able-bodied. So I try to supplement with my arm bike and my resistant bands, but it's never worked out. So I have to find a different way of eating and what I'm eating based on what's going on. Like last night, I probably shouldn't have had a whole plate of Chinese food, but it was good. So I'm still trying to figure out the different foods I should eat, but also still remember that the portion sizing worked for me in the past. So I'm not overindulging. If the bag of chips is 3 servings, I know that I can only have a certain amount. So I would pour out that certain amount, roll up the bag, and had my fiance throw it in the pantry where I can't find it or can't get to it. And I've been really good at just trying to not count my calories, but count my portions. The calories.
Thank you, Christian. Thank you. That's all very helpful information. Lihia?
Yes. So I just wanted to say that there is definitely a relationship with food that everybody has, right? That depending on our experiences growing up and our influences, sometimes psychologically, it determines what, how we feel about our diets. And so I wanted to ask all of you, before your injury, what was your self-esteem like? And, what have you noticed has changed? So if you could briefly tell me, tell us what your experiences with that. Go ahead, Chelsea.
Yeah, so before my injury, I struggled with my self-esteem constantly. And that was something that I was always kind of working through myself. But one thing before my injury that was great is if I, started to feel a certain way about the way my body looked or whatever, I was able to go work out or go like jog or go on a hike, and really like those were my different types of outlets. And that was really nice to kind of have that physical exertion and be able to kind of let all of my energy out. And it was great because after I would work out or whatever, I would almost like, I wouldn't say instantly see the results, but I would, after a couple of days, I would kind of start to see a difference pretty fast. And so that was really nice to be able to see that. And it also helped mentally as well. And so now after my injury, I've been struggling a lot with just body image and how my body's changing. Like my body has changed drastically from when I was first injured to now. And so it's a process to kind of see your body constantly kind of transform. And of course, like our weight fluctuates and stuff like that. And so that's been hard with like seeing like the muscle atrophy and just becoming more skinny, but then a little bit more fat in different places that you might not want to be. So it's been hard for sure, but yeah.
Thank you. Yeah. Christian, how about you?
So prior to my accident, I could wear anything, eat anything, feel good in anything that I wore or how I felt. My self-esteem was extremely high, somewhat cocky, but I was in love with myself back then. After my accident, I became a little self-conscious about my abdominal area, because we know quads, we have our quad belly that it's there and it's not really something we can just squeeze or suck in. It's kind of our relaxed abdominal area. So I kind of went to the baggy side of clothes. I want to make sure that my clothes didn't accentuate the certain roles that my body had naturally. But I also had a bladder augmentation to allow myself to cap myself through my belly button. And that belly was accentuated, now with scars because of the surgery. So at that point, I'm like, my body is the way it is because it's allowing me to be independent now. So I embrace my belly. My mom's like, your belly's out. And I'm like, I don't care. So it's, I learned to love my body the way it is. One, I can't change it. So since I can't change it, I have to embrace it. So I embrace it with, I might pull my pants over my belly so I can show my designer pants, or to my designer pants, my pants to me being designer. But it is my apparel and what I wear allows me to feel comfortable.
Yeah.
So I'm sure that I don't wear those tight stretch pants that will cut underneath my belly. I make sure I have pants that go over and feel comfortable with what I am. So
you've modified your clothing and things. Good. Thank you. How about you, Rafe?
So prior to my injury, I had really good self-esteem. I would say I never really struggled with that. I felt maybe a little bit on the cocky side too. Could exercise. I exercised quite a bit. Was an athlete and did a lot of hiking and running, and was always fit and never really struggled with that. And then after my injury, everything changed dramatically. I didn't have the same muscle strength or abilities, and the muscle atrophy happened. I did see during rehab, I was exercising quite a bit, so I felt better about myself. Over the last 19 years, I have also developed a quad belly, like most quads do, and definitely more self-conscious of that than I used to be. I'm also had some different changes to increase my independence. I have a suprapubic catheter, so managing my bladder that way is making myself more independent. I have to get used to that. And then also, as a lot of quads, we do a bowel program, and mine was taking like longer and longer as I got older, and was having more difficulties there. So about a year ago, I got a colostomy surgery, and that has overall been a really positive for just making myself feel better and healthier and managing my bowels. But it's also been an adjustment with my self-esteem, because now I have another thing that I've changed with my body, and I'm definitely self-conscious of my belly. But I've learned some different ways, some different clothing, things to put over, including self-help. So that's helped me feel a little bit better about my self-esteem.
Thank you. Yeah. All these other things that we have to think of, right? How about you, Hector?
I definitely grew up, in my middle adolescence, between those ages of 7 and 10, just feeling very insecure, very lonely. I felt like Rudolph the Red-Nosed Reindeer. My siblings wouldn't allow me to play in their games and stuff like that. I was short, wasn't strong enough, wasn't big enough, until my adolescence came along. And when my 13, 14 years started coming along, something happened in regards to, I started doing gymnastics, and and so I found something, a sport, that I could do that really allowed me to, for people to look, for people to give me attention. I was able to get those emotional, just those emotional praises. Wow, what you do and stuff. So I started identifying myself as an athlete, and which got me, great self-esteem. But when I kept on looking for my self-esteem or my self-worth from things outside of myself, whether it was other people, the things I did and stuff like that, there was just never enough. And that's, for me, I believe that was the beginning of my addiction. My substance abuse addiction started there, because that's when I started using drugs and alcohol. And that's how I had my accident when I was drinking and driving at 17 years old. I ended up hitting 2 cars in a brick wall. And so my self-esteem dropped dramatically, because now I felt like I let everybody down. I felt like I let myself down, my parents down. I felt that I brought shame to the family and stuff like that. So I always tell people that I didn't wake up to the awareness of accepting my disability until about 10 years afterwards, because I was so stuck with the substance abuse and all about what you wanted me to be doing and the way you wanted me to be feeling instead of how I wanted to be or how I wanted to do with my life. So it took me a long time to wake up from the injury.
Yeah. So a
So
lot of other
that-
things influence your mental health, right? And influence your self-esteem. So that's a good segue. How has all of this affected your mental health? Like right now, and in the, I guess also as it relates to your, your diet changes, and why did you make those changes? Like what was the reason, if it wasn't just for, to be healthier, but I really want to know, so how has your mental health been affected? What do you do when you go to moments of insecurity, frustration, things like that? And like how have you gotten through those times? What are some resources that you've used? So how has your mental health been affected? Where do you go, when you what do you do when you get into those moments? And what are those resources? Go ahead, and why don't you continue, Hector?
Sure. Yeah, just to touch a little bit on that. Once I had to deal with, first of all, I had to deal that I had an addiction. That took me a while to admit to, and that I need help with. So what helped me the most was a support network. And even getting a support network, I was still playing that role of, well, okay, so I got to say the right things. I got to, just mimic what everybody else was doing. So that didn't change until I really found myself in a group of other men. I was going to a 12-step program, and I didn't see nobody else in a wheelchair. So I said, man, you guys can't identify with me. You can't relate to me, because none of you guys are in a wheelchair. And they go, well, you're right about that, but tell us about how you feel. I said, I feel pissed off. I feel angry. I feel insecure. I feel like shit. He goes, that we can relate to. And you don't need a wheelchair to feel like shit, insecure, or whatever. So for me, what changed for me and what works for me today is exactly the type of coach I am today. I had to find that transformation. The way I found that was spirituality. Meditation was a big part of it. Honesty was another big part of it. I had to get honest with myself, and I had to get honest with other people, because I wasn't going to be able to utilize a support network if I wasn't being honest. If I was just trying to say the thing that they wanted to hear, in order to sound good, that didn't do anybody any good, because it wasn't real. So I had to keep it real. And so what I had to really realize for me, and what helped me out, was my spirituality, my meditation, my support network, and the realization that what I feel about myself affects how I think about myself, and how I think about myself affects the decisions that I make about myself. So I am taking better care of myself today. I now go to the doctors today when I don't feel right. I don't wait. I don't try to fix it on my own. I just go right to the source and say, hey, listen, this is what I'm feeling. This is what I'm thinking. What do we need to do? All right. Just trying to keep it real simple instead of trying to figure it out by myself. I find out that having a support network is number one, and having a strong faith in whatever that is, and whether I power greater than yourself, whatever you want to call it, Jesus, God, whatever you want to call it, as long as it works for you, as long as it makes you feel good, as long as it feels like it brings you some clarity, some positive self-esteem, some positive self-worth, I'm good with it. So.
Thank you. Yeah, thank you. Go ahead, Christian.
I'm with Hector. I turned to spirituality right after I was in ICU. A lot of people go to spirituality, and that's it. If they've had it in the past, and I did. I've been in church all my life, and I was really running from a calling of being a public view and being in helping others. And I ran from that for a very long time. And to me, I feel as if God was telling me, well, you can't run now. So you might as well just come to me when you have aches and pains, and spiritually and physically. And that's what I did. I woke up and like, well, he must have a plan. So I have to get with the plan. And I turned to my Bible, and I turned to other members of my church home, and listen to scriptures or whatnot, just to keep me going. I was a very strong in my faith and in my church. I was a part of the youth ministry and the young adult ministry, building that up at the church that I was at, and it helped me through a lot. I was single for a very long time, from right after my accident until the last, well, I've been with my fiance for about 5 years now. And that time I worked on myself. And I felt that if I worked on myself for at least 5 to 6 years, I can be enough for somebody else. And through that whole time, it was rejection after rejection. And at first I was considering, maybe it is me, maybe it is my chair. But if they can't accept my chair, then they can't accept me. So, because I'm a part of it. And it was to a point where it was this one gentleman that I really liked. And he was like, well, I'm 98% sure that you're the one. I'm like, what's the other 2%? And he was like, your chair. And that was like a turning point where I'm like, I could let his reaction and his thought of me to say, well, I hate my chair too. But it allowed me to say, okay, so you're the person who I do not want. So I'm going to continue to pray on this, and I'm going to continue to love me and my chair. I had to dismiss a few people who thought of my chair negatively.
Yeah.
Keep that negative out of the way.
Yeah. Thank you. Thank you for sharing that. That's really, that would definitely be a turning point. Go ahead, Rafe.
So for myself, my mental health, I've had pretty good mental health most of my life up until my injury, and grew up actually also with a lot of spirituality, grew up predominantly Christian and Catholic. And then a lot of those belief systems worked for me and support worked for me. And as I got older, I started turning more towards yoga and meditation, and actually had my injury while I was in India on a meditation retreat, which was interesting. And it was actually a pretty profound experience for me, because I was able to take a lot of the practices of being able just to sit, because like I was very active before my injury, and now that I'm not as active and I do have more chronic pain and aches, I've used meditation and mindfulness in many ways for both community and connection, as well as just having my own personal practice. I notice I feel a lot better when I meditate at least once a day, not more than once a day. And sometimes that's just a minute or two, and sometimes it's, I do a longer sitting practice. But having community and the spinal cord community has been also really important. Having other quads I can talk to and close friends that can identify with some of the struggles I've gone through is really important. And also just having different intimate relationships has also been really good for my self-esteem. And sometimes I don't feel like I'm enough. I have people that can tell me that I am, and it's not just all my physical abilities or disability. It's something deeper, and that means a big difference to me.
Thank you. How about you, Chelsea? Excuse me.
Yeah, so my mental health was drastically affected. With my car accident, I was the passenger, so my friend was driving, and she passed away on impact. And so that was a hard loss for me, and I had a lot of survivor's guilt, like why am I alive? Like why did that happen and stuff. And so that was really difficult to kind of navigate and work through. And I've always been, I grew up in church and stuff, and so I've always had a relationship with God. And so at first I was very angry, questioning why me and all of that. And now I have a stronger relationship with God, and I listen to sermons, and I try to go to church and listen to different podcasts and stuff to kind of grow in that relationship. And I've also turned to meditation as well. I just took a course called mindfulness and meditation practices. And so that was really cool to kind of dive into and explore. Very interesting. And that has actually helped out a lot, because with this injury, it's a lot mentally. It's very consuming, and so to have an outlet to kind of just escape a little bit and meditate and be present and ground myself has been an amazing process for me.
Thank you. Yeah, you know, it wherever you can find strength, whether it be your spirituality or your friends or, you know, something that's positive, that's good. One last question, and please, in maybe if a few words, if you can say how long it, or how did it get you to the point of accepting your new body and your new life, and what advice do you have for others? And 1 minute, everybody gets 1 minute. Go ahead, Chelsea.
Okay, so for me, I'm still working through the acceptance. I'm 3.5 years in, but I think about my third year, I just came to that realization of my injury, the extent of my injury, and my ability, my functionality and stuff like that. And so it's for sure been a challenging process, but I just kind of came to terms with it. Like, it is what it is, and let me just continue to get stronger and work through what I have going on, and just continue to practice different things like putting my makeup on and stuff, and working on those like fine motor skills and just practicing that. And so I think, I've come to terms with that, and just continuing to get stronger and work through the things that I can do. And my advice would be just to continue to pursue your dreams and goals, no matter what it is. Like, you can do it. It's just going to look different, but that's okay. And there's just so many resources and different support systems out there to reach out to. And it's just a wonderful, beautiful community.
Thank you. How about you, Christian?
For me, it's love the skin that you're in. And it was really instant. It was within the first 4 months. I left rehab happy and ready to conquer the world. The only thing that was holding me back was transportation. And I really, to a point where I was sitting in ICU with 2 IVs and a tube down my throat saying, God, if it's your will, let it be. And I'm like, I can still teach. I still have a voice. Nothing's going to stop me from doing what I do. Within 2 years, I was at college, again, taking it day by day. I ended up graduating with a bachelor's and a teaching credential. I have 1 more class and I have my SPED credential. I have 4 more classes and I have my master's in special education. So the acceptance came real quick. I'm now accepting diagnosis of different diseases that I didn't even know I had until my spinal cord injury. I have autoimmune disease that I didn't know I had. So accepting those have been a little bit more difficult, even though my body's had it already. But accepting my wheelchair, and that has been very instant. I call it my accessory, my fashion statement.
That's awesome.
Yeah, it's, and I have kids, of course, I work with kids. So I have the littles, 5, 6, and 7s. What's wrong with your legs? So, I teach every day about spinal cord injuries, and it's kids are so curious that if you're educated on what not to do, like to try to get off the freeway in the fast lane when you're So, just the awareness that I have every day allows me to be fulfilled. I have people, strangers who come up to me asking me, and to educate it's what I do.
Yeah, no, that's great. Thank you for sharing that. How about you, Hector?
I think for me, it's just be honest with yourself, be open-minded, all right, to try things differently, and be willing to change. I'm a big believer, as it's already been said now, in Living in the Power of Now. Great book that was done by Tolley. And the thing that I got from that book the most is that judge myself less and just observe myself without. give yourself a break, and really try to be a little bit more gentle and compassionate towards yourself and others. Because you started out, Leah, by saying we're all in this together. You're right about that. So I think we should just be a little bit more gentle and compassionate towards other people. Be kind. It'll take you a long way, making friends and getting the support that you need and getting and living further, and
Thank
healthy.
you.
Because I think a lot of it, the way we think and the way we feel, causes illnesses as well too.
Right, right. Yeah. Thank you, Hector. How about you, Rafe?
So for myself, I would say that the most important thing for me has been just learning that, life has always, there's pain and suffering that goes into life, and that pain is inevitable, but suffering is optional. That's something I learned in a lot of the meditation I've done, is just being able to accept this is my circumstances here and now. Things may change in the future, but the more I love myself and accept myself, the better I feel. The other thing is just finding things that finding pleasure in life, just finding simple pleasures like sitting in the sun, or taking a hot shower, or having a conversation with a friend, putting something good that's healthy and tasty in my body. So just finding those simple practices that keep me in a positive frame of mind, and also having somebody to talk to, whether it's a therapist, a family member, other friends, like just having support around me is really important. Don't be isolated, because it's easy to get isolated. Especially during the pandemic, it's very easy. So that's important.
Thank you. Yeah, and I really want to emphasize how much somebody else mentioned it. I can't remember who it was, but your body is amazing. I mean, it saved you. You're alive. It every day, like it shows up. It's not absent. You don't realize how amazing it is. It went through a really traumatic experience, and it may not work the way that we used to work, or it used to work, but it finds ways, and so we our bodies are amazing. And so I just really want to emphasize how much we should recognize that, and how amazing we are for enduring something like this. And it's not every single person in the world that gets to experience things that can take you to a really compromising space. And so love yourself and be very grateful for you, because you're great, you're amazing. So I want to say thank you to our panelists. I think we can talk for hours, and unfortunately we don't have hours. I wish we did, but we could open it up to questions now.
Let's have Dr. Pasapino.
Oh yes, I'm so sorry.
So my colleague, Dr. Pasapino, we have her with us. I've worked with her for a few years. Fantastic. Do you want to introduce yourself and maybe add a little bit to this? I got a couple questions about depression and emotional eating, but what do you have to say?
I'd like to thank everyone who's spoken today. It's been really enlightening to hear the experiences and the wisdom that you all have to share on this topic. So my name is Elizabeth Paspanaja, and I'm a licensed psychologist and a research manager at Valley Medical Center in San Jose. So I thought it might be helpful to talk a little bit about the clinical criteria for body dysmorphic disorder and some of the treatment options there are for it. And some of these treatment options are actually going to dovetail really nicely with some of the things that the speakers were saying. So body dysmorphia has three components. So the first is preoccupation with appearance, where someone might spend a lot of time thinking about or concerned with one or more perceived flaws in their physical appearance. And this preoccupation would be operationalized as spending at least an hour a day thinking about flaws. And then the second thing would be repetitive behaviors, where someone would do repetitive compulsive acts because of these appearance concerns. And these compulsive behaviors would be motivated by strong, irresistible urges. And they might include excessive mirror checking, making frequent adjustments to one's position or clothes to hide sensitive body areas, or are constantly seeking reassurance from other people that one's appearance is fine or okay. And then lastly, and this is probably the really important part, is there's significant distress or impairment in important functions, like maybe this concern with appearance gets in the way of engaging socially or with work or other areas of life that are meaningful. So learning about body dysmorphia and the symptoms of body dysmorphic disorder might bring to mind some other conditions that involve distress with one's body, like eating disorders such as anorexia or bulimia, and there is significant overlap between these. But with the eating disorders, the concern is typically around general weight and size, and with BDD, it tends to be more focused on flaws in specific body parts. And then eating disorders often have the restricted or disordered eating, and body dysmorphia may or may not. But there is a high degree of overlap between these conditions. And in terms of treatment options, the leading evidence-based treatment for body dysmorphia is cognitive behavioral therapy. This is the gold standard for many different health concerns, mental health concerns, and it involves helping people identify unhelpful beliefs or thoughts. In this case, that would be related to one's appearance, and then helping to reframe them. So kind of seeing things differently, often seeing things more realistically. And cognitive behavioral therapy can help with reducing the frequency of the compulsions that contribute to body dysmorphia. And then a couple of people mentioned this. There are also mindfulness-based therapies like acceptance and commitment therapy, and these are really good treatments as well, or practices that one could take to help with image concerns. And then for severe symptoms, there's also pharmacotherapy, in particular selective serotonin reuptake inhibitors, and these are also pretty effective for depression and OCD, which are also commonly occurring with body dysmorphia. And other than, well, one should always reach out to speak to a qualified healthcare professional, but there are a few things that you can do to help maintain a healthy, positive self-image. And the first thing might be to take an inventory of the negative influences to body image in your life and consider how you can reduce their impact. Some of these influences might be from social media or from negative peers that make it difficult to accept and feel happy with who you are. But these influences also might be your own critical thoughts or criticizing thoughts about your own body. And given this, it might be helpful to practice self-compassion and mindfulness. And then it can also be helpful to seek out people and positive role models that celebrate a diversity of body types and sizes. So Shelley had shared some resources at the beginning of the meeting, and those are particularly good books from, most of them are from a mindfulness-based perspective on developing a healthy, positive body image.
Wow, thank you so much. I mean, your breadth of knowledge in all of this is spot on, and it's very helpful. And one of the things that we didn't talk about was how culture influences all of this as well, and that is for another day. But it's, you know, that could also be a part of how we see our bodies and how we like what our diets are like, what our emphasis on certain body types are, and things like that. So thank you very much. So yes, now we will definitely open up for questions.
Yes, so
sorry.
we're at the 1 hour mark. I just want to let everyone know if we're gonna run over a few minutes, we are recording this. I only really got a couple of comments. I just want to say that I got a couple of comments about emotional eating. One particular audience member said it's hard because they feel like they've lost so many other pleasures, but it's very difficult to deny foods that you like and crave. And there is another resource that I want to add. I can do it at a later time. Because one of the other questions was, where do we get the resources? So I'm hoping we can coordinate with NorCal and put out an email with all of these resources in them, Lihia, and I'll include, there's one thing called the 5 Ds regarding cravings and that kind of thing. So in the evening, if you're, you're tuned to having potato chips at a certain time at night, that kind of thing. So I want to share the 5 Ds. I'm not going to do it right now. But the resources, that was a big question from audience members.
Mhm.
Isn't
Yeah.
it normal to experience depression after a spinal cord injury? I think people mourn the loss of their old life. I know I did. That was another comment that we got. And then we had one question about bowel obstruction. Our audience member wanted to know if anyone had issues with bowel obstruction.
There was also one about anger management and anger issues and how that affects everything too. So there's some info that we can share on that topic as well.
Any other questions? So the bowel obstruction, that was a specific question. I, as a dietitian working with spinal cord injuries in the community, I have not come across many bowel obstructions. Some of that is because of a lack of fiber in the diet. So the audience member had mentioned that they were recommended to follow a low fiber diet. I just want to say that there is no one size fits all for the community with spinal cord injuries. There is no one size fits all. And believe me, I know this because I have worked with so many people in the community, and one thing may work like a charm for one person and it may not work for the other person. Neurologic bowel is very fickle. I'm constantly working on helping improve bowel programs, and I will tell you that there is no one size fits all at all. And I did hear one person mention something about off-limit foods. No foods are off limits, but there are a lot of foods that make you feel better, and there are a lot of foods that make you not feel too good. And so I just wanted to put that out there.
Yeah, and again with the slides, we will ask NorCal to please distribute the information that we shared and contact information as well. So you will be receiving that. Yeah, and is there anything else that, I think that if there aren't any other questions, I mean, people still can ask questions.
Any more chat questions? If you want to unmute yourself, if you have a question you want to ask, that's okay. We can stay on for a few more minutes. This has been really informative, though. I really want to thank all of our panelists. They're very inspiring. I love that all of you are out there as peer supporters. It's fantastic.
Yes, very great panel. I love your examples, and you're just no limits. It's great.
All right, I don't see any new questions. We'll definitely make all these resources available. We'll put something together, and NorCal can push them out. Arash, if you're lingering around somewhere, do you have anything else to add coming from NorCal?
I'm lingering. I really enjoyed the conversation and want to thank our panelists for being so generous with their time and resources and thoughts, and to you and Shelley, you and Lihia for hosting. So no, I think this was a great event. I think it's a really relevant conversation. I think there's a lot more we can talk about. Obviously, I personally know I'm 10 years into my injury, and I still can't say I'm fully made peace with my body issues, but I'm trying. So it's a journey, and I'm on it like many others, and I really appreciate all of the perspectives that we heard from everybody. So yeah, we will try to just maybe shoot an email out to everybody who attended, and I'll try to get whatever you and Shelley, you and Lihia, whatever you put together in terms of the links, resources, whatever you have, we'll put that into a document, and I can send that out to everyone who attended.
Okay.
So keep your eyes and ears out for that. We'll try to get that out as soon as we can.
All right.
Thank you.
All right. Well, it was a pleasure. I learned from from this experience, from hearing everybody, and wish you all the best of luck. And I'm sure I'll encounter you at some point or another.
Look forward to it, guys.
Thank you all.
Yeah, thank you.
All right.
Thank you, everyone.
Bye.
Real quick, sorry, Shelley, if you can stay on.
Yep, I will. I'm going to stop recording.